Cancer is a malignant tumor or neoplasm. One distinguishing characteristic of cancer is the quick development of aberrant cells that expand beyond of their normal borders, infiltrate other body components, and spread throughout your body. Metastasis is the term used to describe the latter process. The main reason why cancer patients die is because of widespread metastases. The second greatest cause of death worldwide is cancer. On the other hand, because to advancements in cancer detection, treatment, and prevention, survival rates are rising for many cancer types. The most common type of cancer on the list is breast cancer, prostate cancer, lung cancer, and also colon and rectal cancers that are often referred to as colorectal cancer. Approximately 1/3 of cancer-related deaths are attributed to cigarette use, high body mass index, alcohol usage, a poor diet high in fruits and vegetables, and a lack of exercise. In lower middle-income nations, cancer-causing infections, including the human papillomavirus or HPV, and hepatitis are thought to be the cause of 30% of cancer cases. If caught early and appropriately treated, many tumors are curable. However, many people with cancer show no signs of the disease. These people's cancer is discovered while undergoing a test for another ailment or disease. Depending on what part of the body is affected, cancer can create a variety of signs and symptoms. The following are some typical indications and symptoms of cancer that are not particular to this disease: fatigue, weight changes, including unintended loss or gain, persistent pain, fever that occurs mostly at night, skin changes, such as yellowing, darkening or redness of the skin, sores that won't heal, or changes to existing moles, changes in bowel or bladder habits, persistent cough, difficulty swallowing, bruising or bleeding more easily, difficulty breathing, persistent indigestion or discomfort after eating. Changes, mutations to the DNA within cells or what lead to cancer. A cell's DNA is organized into numerous distinct genes, each of which carries a set of instructions directing the cell's performance of certain tasks as well as its growth and division. Incorrect instructions can make a cell cease functioning normally and even give it the chance to develop cancer. The first most prevalent malignancy is breast cancer. The most frequent and most prevalent cancer diagnosis in men is prostate cancer. The third most frequent malignancy is lung and bronchus cancer. Risk elements: the majority of cancers occur in people without any recognized risk factors, despite the fact that doctors have a notion of what may enhance your risk of developing cancer. No one is completely safe from cancer. There are many possibilities that could be the cause. The following are risk factors for developing cancer. 1. Family history. A very small percentage of cancers are brought on by an inherited disorder. If cancer runs in your family, mutations could be handed down from one generation to the next. If you want to find out if you have inherited mutations that could make you more likely to get a particular cancer, you might be a good candidate for genetic testing. Remember that not everyone who carries an inherited genetic mutation will develop cancer. 2. Age. Cancer can take decades to develop. That's why most people diagnosed with cancer are 65 or older. While it's more common in older adults, cancer isn't exclusively an adult disease. 3. Environment. The environment around you may contain harmful chemicals that can increase your risk of cancer. If you go places where people are smoking, or if you live with someone who smokes, even if you don't smoke, you could inhale secondhand smoke. Additionally, exposure to chemicals like benzene and asbestos at work or home is linked to a higher chance of developing cancer. 4. Habits. It is well recognized that some lifestyle decisions raise your risk of developing cancer. Tobacco use, excessive alcohol use, up to 2 drinks per day for males and up to 1 drink per day for women, frequent blistering sunburns, excessive sun exposure, being fat, and unsafe sex are all risk factors for cancer. 5. Health conditions. Your chance of acquiring some malignancies can be significantly increased by certain chronic health disorders, such as ulcerative colitis. Inform your doctor of your risk. Are you worried about preventing cancer? Take control by making adjustments, such as switching to a healthy diet and scheduling routine checkups. Consider these lifestyle tips to help prevent cancer. Eat a healthy diet, eat plenty of fruits and vegetables. Avoid alcohol, reduce consumption of processed meat. Don't use tobacco. Protect yourself from the sun's rays. Maintain a healthy weight and be physically active. Get vaccinated. Defending against specific viral infections can aid in cancer prevention. Consult a medical professional about becoming immunized against